The Bob Fenwick program was created following the death of Bob Fenwick at Bloomfield Hospital in Orange, and a memorial grant program was set up in his name to carry on the work that he did mentoring junior staff in mental health.
Its objective is to provide opportunity for registered nurses to gain additional experience in a setting of their choice, and I was lucky enough that Sarah was happy to come here.
I found out about the program through the Nurses Association. I applied then.
She indicated she had an interest in child and adolescent mental health and working with young people. I've tried to structure the placement around as much exposure to different ways of working and different disciplines and different team dynamics as possible.
So I tried to organise a range of different settings for Sarah to work within for these 5 days.
Community, inpatient, PEC, as well as some academic involvement, so going to things like journal club, and this morning we've been at a complex case review for psychiatrists.
I've been able to spend each day with a different community-based team, so I've been able to attend sort of conceptual meetings, home visits, go to tribunal hearings, so sort of broadening my horizons and seeing how they do things here in this district.
Consolidating it all and looking at what different services are doing, and taking a little bit from their service and telling them a little bit from ours as well. So it's been really beneficial. Yeah.
It's been quite comprehensive around the different clinical settings and how people work in a really holistic way with young people in mental health.
Some things we do the same, whereas these guys use the strength model down here.
Yeah.
They use a different model of care.
They may not seem that big, but I think there are differences, and the nuances have sort of they've been getting me thinking about how I can apply that in my area.
The complex case reviews has been fantastic. I feel that I've got a lot from it.
I think it's just been spending time with different clinicians and just getting advice and speaking to them about how they do their job, how they interact with their clients.
And it's also really good, I think, for the other staff that she spent time with have all provided some positive comments about having someone with a bit of experience making some very relevant queries and questions that get us thinking, so it kind of keeps us on our toes a little and makes us reflect on the work that we do. So that's been excellent from our point of view.
So many more resources, so many different services, and there's a lot more input.
Sharing what we do with people who may or may not work in that model is really exciting, and I think it builds relationships across local health districts in nursing, and there's a lot of commonality in the things that we do and the way that we think and the fact that we are nurses.
It has been interesting, different frameworks and approaches to care, I guess.
I want people to be invigorated and see that you really do love it, and I think that's a really important thing to share as much as the skill set, that nursing's really satisfying, there's great opportunities out there, it's not just one career path.
The skills that I have learnt here, there are a lot of things that I can take back to the unit that I work in, so it's been amazing, really.
Well, I would certainly recommend it to services if you have the opportunity.
I'd say go for it, really, it's a great opportunity to share with other nurses.
It was so easy to do and getting involved with.
Very beneficial, it's really good to share knowledge.
Great experience and great networking as well.
It's been great, I love it.